And good evening. Thank you for joining us. My name is Tal. I'm the Educational Director at the American Academy of Functional Health. And with me, we have Dr. Chill.
Hi, everybody. Welcome.
And, and we sincerely apologize. We are behind schedule today, seriously behind schedule. We had some technical challenges where we started a preparation and for the new summit that is coming up next month, October 12th. We have the Clinical Functional Medicine Summit. So we were doing some technical preparations today, and we had to unplug and plug back everything for this podcast today. So thank you for your patience. We really appreciate it. As usual, we were looking forward, eager to be here with you every Wednesday evening and talking about functional, integrative, nutritional, and herbal medicine and how to help your patients. So Dr. Chill and I were thinking about and preparing for this week's podcast. And every week we take a different condition, diabetes, a certain autoimmune condition, women's health, hypertension, and different conditions that we're seeing in practice and you're probably seeing every day in your practice. And we break down the different functional medicine root causes. We talk about the pathways and the mechanisms, and we talk about some natural solutions that your patients can use so they can benefit, improve their health without adding more prescription medications. And we always enjoy doing that. And this week, as we were preparing for this podcast, we were thinking about what can we talk about this week that will be valuable to all patients, which means it doesn't matter which condition they have, strategies that would help all patients, including ourselves. And so in today's podcast, we're going to be talking about 5 superfoods for modern diseases. And I feel like I just love this topic because this is really what we're going to talk with you today is really all about using food as medicine. So I'm excited about it. I know, Dr. Chill, you're excited about it.
Absolutely. I love this topic.
Yes. And we got to blame somebody for the technical issue. So we'll blame the moon. Dr. Chill just brought it up. I almost forgot that it was a full moon yesterday. So we get that loony effect, right, on our technology. So it's a blessing we can reconnect and be here with you. And so today's going to be a little bit different than the usual functional medicine pathways and then mechanisms and then different treatment options. Today we're really going to talk about functional medicine as well, because that's Dr. Chill has been doing functional medicine over a decade. I've been also doing functional medicine over a decade. We invested dozens of thousands of dollars into our education in functional medicine, nutritional medicine, probably easily over $150,000, like easy, just on functional and nutritional medicine. So in today's episode, we're really going to talk about what foods we should all be eating, we should all incorporate into our diet. How does it work, right? Because and you probably remember this, Dr. Chill, like nutritional classes in college, like Nutrition 101, right? Or even when you get deeper into nutrition in like higher degrees, right? They talk about nutrients and, you got to get your vitamins, you got to get your macronutrients, you got to get enough protein, healthy fats. But in so many cases, they don't really tell you how does that actually, like from eating the food, how does that actually improve cardiovascular diseases? Or how does that actually support healthy cognitive function, right? Like how does that reduce the risk of cancer or what, So it's really interesting, and that's something we're going to talk about today. So we know that, just as a definition, superfoods are essentially are foods that offer an exceptional health benefits. This goes beyond what you typically expect to see just based on nutritional profile, right? So when you go to a dietitian, and no offense to any dietitian out there, we have a few in our program, in our advanced functional medicine program, but the general concept that the dietitians are following is they look at foods as number of calories of fat, number of calories of protein, number of calories of carbohydrates or whatever it is, right? And what vitamins and nutrients they have. But here we have a more holistic, with a W, like holistic approach to looking at what are certain foods containing that would be beneficial in prevention of diseases, right? So that's exactly what superfoods are. They're supposed to support certain physiological function, and they're associated with multiple benefits, such as reduced risk of metabolic and cardiovascular diseases, balance or modulate immune function, prevention of cancer, improve lipid profiles, lower cholesterol, healthier aging. We're going to talk about a few of those interesting mechanisms today. Reduce the risk of bone loss and improve cognitive function. We're also going to talk about some of those pathways of cognitive condition, neurological degenerative conditions, and how some of these foods could be beneficial. So this is, we're very excited about it. So we know that superfoods are not naturally recognized category of foods, right? But they have all these benefits. So how is it that some of those superfoods we're going to talk about, for example, the first one we're going to talk about is we're going to talk about berries, then we're going to talk about some other stuff, right? And so very interestingly, like, why is that considered a superfood, right? And how would some of those superfoods are able to achieve such, when you eat them in the right amount, able to achieve a reduction lead to reduction or be associated with reduction of cardiovascular diseases, chronic inflammation, all of that stuff. So how do superfoods do in all of this? So superfoods, they contain bioactive substances, right? So we're talking about fiber, talking about antioxidants, beyond vitamins and minerals. We're talking about polyphenols, right? And this is when we eat some of those foods we're going to talk about today, or spices, they contain what we call full spectrum. And this is very different than a pharmaceutical drug that has one or two active ingredients and has a very specific molecular function, right? Here with superfoods, we're talking about full spectrum. So you can get over a dozen different types of bioactive substances and polyphenols, which essentially reduce pro-inflammatory cytokines, which reduce chronic inflammation. So why is that important? Because chronic inflammation, we know that it is one of the major contributors to so many chronic conditions. For example, when you have chronic inflammation, it's not just the inflammatory cytokines, but they also, all these inflammatory pathways also increases their amount of reactive oxygen species. In other words, we can call them free radicals, right? So if you remember free radicals, they float around, they're missing an electrons, and they borrow electrons, leading to instability in the cells, in the molecules around them. So essentially, they're causing damage to cell and organs. So here's an interesting picture. We love using visuals because one picture is worth 1,000 words. So here's an interesting picture from a medical journal published in Frontier in Pharmacology. And what you see here is how chronic inflammation can contribute to so many conditions. Starting from the top, you can see inflammatory bowel disease, psoriasis, neurological disorders, Alzheimer's, Parkinson, dementia, metabolic. Diabetes, for example, is it's a systemic inflammatory condition. There's cancer is also, there's a very strong association in multiple studies between between inflammation and then the imbalance in the immune system that disrupt the natural killer cells from killing those cancer cells, terminating those cancer cells, right? Also, we're talking about, of course, bone and muscle and joint disorders. And then we're talking about cardiovascular diseases, which makes sense, right? Cardiovascular disease, it's easy to think about it. There's inflammation, there's higher risk of atherosclerosis. Interesting, I wrote an article just recently about cholesterol, and there are so many studies that are showing that high cholesterol could increase the risk of cardiovascular disease and atherosclerosis. But in order to do that, inflammation must play a role in that process, the arteriosclerotic process. So inflammation is, and we dive much in depth into these pathways in the advanced functional medicine program. But if you want to read more about this, I put the citation on the right side. It's called Phytochemicals in Treatment of Inflammation-Associated Diseases, the journey from preclinical trials to clinical practice. Again, very interesting study. And so we know that superfoods are rich in antioxidants, which protects our cells from oxidative stress, from the damage of reactive oxygen species. And just by doing that, we can prevent or at least inhibit the damage to our cells, right? It also contains minerals, vitamins, which are very important, right? For example, calcium is really important, potassium, selenium is a powerful antioxidant, right? We have multiple vitamins that are essential, like B vitamins, important for mitochondria, for energy production in the cells, right? So there's so many but beyond that, so many nutrients are important. But beyond that, we have also fiber, which helps reduce cholesterol, prevent heart conditions. Flavonoids are really important. We're going to talk about some of those today. And it's flavonoid, interestingly, they used to be called vitamin P, and they have anti-inflammatory, anti-carcinogenic properties. And then, of course, some of those also, superfoods contain healthy fats, monosaturated and polysaturated fats, which are also helpful. So very excited about today. I wanted to give you that little intro so you understand how it works in a general kind of a view. And now, Dr. Chill, you're going to take us into the first superfood. And
yes.
So we're very excited. So,
and this is an awesome topic just because this is so easy to incorporate into your daily routine. And this is easy to educate your patients on how to incorporate these. And we're going to talk about that as we're going along with these superfoods. And as Dr. Cohen was mentioning, the first superfood that we're going to talk about are berries. I actually incorporate these into my daily routine, probably on a bi-daily process. So every other day, I probably have some sort of berry in my daily regimen. So the berries that I'm talking about, these are your strawberries, your blueberries, your raspberries, blackberries, and these are all potent options. And it's because they are all rich in polyphenols, as Dr. Cohen was mentioning, also antioxidants. They provide a high amount of water, fiber, and then other micronutrients. And they help with managing inflammation. They also do a lot of other potent things in helping to reduce risk of major issues or major health issues down the road. So speaking of that, I want to discuss a really, really cool study that was done. And this was done on the American adult population. And they analyzed data from over 37,000 individuals. And what they did was they took a look at their berry or flavonoid consumption on an intake. And they did this and analyzed their 24-hour food recalls. They tracked all their health outcomes over an 8-year period. And then they did a follow-up period with that. And so they were able to draw conclusions from observing these 37,000 individuals. Some of the results were astounding. Some of the results included having a dose response relationship between the intake of total flavonoids, anthocyanidins, and flavones. These are all within the berries. These all shown that the higher amounts that you took, the lower risk that you had in all causes of mortality risk. Another result that they showed was that the higher intake of these berries and these flavonoids, and these were all associated with a lower overall mortality risk in these adult Americans. And then a higher intake of these flavonoids, anthocyanidins, and these are all found in the deep blues and the purples of the berries. So these are your blueberries and your blackberries. These were a subclass. These were also linked to a lower reduction in mortality risk. And then they also showed an inverse relationship between the consumption of these berries and cardiovascular health. What this means is that a higher intake of flavonoids or these berries showed that they had a lower risk of or an improved health of cardiovascular and respiratory health. And then a decrease intake of these showed at a higher risk of cardiovascular conditions and respiratory conditions. So let's show you a picture on how, when you eat these berries, what happens in your system. So we can see on the left-hand side that all of these berries are rich in polyphenols, and it's that polyphenol that goes into your gut. And we talk about the gut microbiota often because it's extremely important in our overall health. And this is no exception with polyphenols. What polyphenols does is it helps to modulate your gut microbiota. And these produce what's called polyphenolic metabolites. And it's these metabolites that shows to be anti-cancerous, anti-diabetic, anti-inflammatory. It helps with your brain and it helps with your cardiovascular health. This is why it's so important to incorporate some sort of berries into your daily or your weekly routine, telling your patients about incorporating berries and these polyphenols into their daily routine. And it's extremely easy to do. You can put it into a smoothie. You can eat them solo. You can put them with proteins or healthy fats. You could add them into drinks. You can add them to salads. And we wanted to show you a really easy way to incorporate berries into your routine, or you can give this to your patients as well. It's called a antioxidant tropical smoothie recipe. So we'll pop that up here. So this is a really easy smoothie that you can do for yourself, or you can have your patients do. Most of the time in my metabolic program, most of the patients always ask for a smoothie recipe. So I wanted to share this with you. We wanted to share this recipe with you because your patients will most likely ask for this as well. But it's 1.5 cups of blueberries, almond butter, some pineapple, some superfood by Amazing Grass, or there's a raw organic perfect food by Garden of Life. You can do unsweetened flax or almond milk. You could add a protein powder, which is optional, and then a handful of ice cubes, and then you just puree all of these ingredients. You can even double or triple the amount of this and put it into a large mixer or blender, and then you can save some for later. So I will typically put it into a large blender. So I'll have 2 to 3 servings that I'll save for the next couple of days as well. And the almond butter in there helps to add fiber and some protein to reduce the absorption of the sugar from the berries. But this is a pretty awesome smoothie. I do a smoothie probably every other day, and it just kind of helps to start my day. And this is what I hear from my patients as well.
Perfect. And this is, by the way, I love doing the shake. So in the summer, I'll start my morning with something like this. In the winter, I'll typically do it later, let's say in the afternoon between lunch and dinner. That's the time where everybody's reaching out for coffee, right? Between that lunchtime, between noon and evening, that 2 o'clock when your energy feels like, oh, I need a little boost, right? So that's where one, you either check your adrenals, maybe your cortisol is just tanking down at that point, and so your glucose levels go down. But if you feel like you need a little snack and some additional little boost, this could be a great one. I love that recommendation, and of course, I like to put some protein in mine. So I have a vegan protein that I like to use, like hemp something, 17 grams of protein. It works great. It's vanilla flavor. So love the recipe, and hopefully you can find this beneficial for you or your patients. So we're going to move on to superfood number 2, and that is ginger. So ginger, we know ginger as a natural spice. It's used in diverse regions, a lot of different Asian foods and Indian foods. So there's ginger has been used in herbal medicine also for centuries. And there was an interesting systematic review that reviewed over 100 studies regarding the different effectiveness of ginger. And what they found is what ginger was helpful for several subsections as they categorize it, right? So there was the first subsection, which was nausea and vomiting, and then gastrointestinal function. That could be bloating after meals. That could be problem with absorptions. That could be even chronic pain. That's the third subsection, pain and inflammation. And then metabolic syndrome, for example, glucose imbalance, diabetes type 2. So when you think about this, when you help a patient to balance their metabolics or improve their metabolics, support healthy gastrointestinal function, right, and reduce inflammation, right, you're already gonna probably impact multiple conditions, from different cardiovascular conditions to autoimmune conditions. Ginger could be very, very beneficial as a supportive therapy. Now, the subcategory of nausea and vomiting, for example, that could be useful. For example, when my wife was pregnant, she had severe nausea, so it was just awful, and we were looking for and her doctor was saying, here's a prescription, and we asked the doctor, what's the risk, and the doctor said, well, we're not sure, but if you take a little bit, there's less of a risk, and then she developed some hives as well, and so we seeked out and found a nurse practitioner that was also trained in the integrative approach to medicine. And we would drive 45 minutes out of Oregon into Washington every time, just because this lady, she had a super busy practice. And it was all because when you go to see her, she offers you more solutions than just the drug, right? And my wife did not want to take the drug. And so she recommended her to do ginger tea, and it worked. So I got her ginger tea, and I got her this little ginger spray, right? It's just a liquid ginger, and she would use it, and it helped. I would say, close to 100% reduction in her nausea. So it was really great. It was a lifesaver, right? It's also good when you think about patients with chemotherapy and they got all that, you get that nausea and vomiting. That could be also helpful as well. Of course, you have to consider each case separately, but that's the recommendation. Typically, the daily dosage that we're looking at for reducing inflammation and metabolic conditions. It's typically, most studies will use between 500 milligrams to 1.5 gram per day, right? So that could be, 500 milligrams divided into 2 dosages, or 1 gram divided into 2 dosages of morning and evening. It's better to take this with food so it doesn't cause any stomach irritation. Now, what are some of the other impacts that we can see with ginger? I wanted to bring you this really interesting picture that talks about the mechanisms, because when we understand the pharmacology of a certain herb, it helps us to better personalize the treatment plan for each patient. So here's an interesting picture that shows you the different properties, beneficial properties of ginger. And you can see cardamom and turmeric up there, because ginger is a part of the same family as turmeric and cardamom. So on top, you can see anti-inflammatory properties. Reduction was found to be associated with the reduction of C-reactive protein, IL-6, 2-necrosis alpha, inhibit COX-2, and then on the left side you can see it's antioxidant, right? Also anti-cancer properties, induce cellular apoptosis, neurodegenerative diseases, right? So increases the master antioxidant glutathione, which is really important for protecting our cells. Increase nitric oxide, which Dr. Chill is going to talk about next, about another superfood that is amazing for increasing nitric oxide and its amazing effects. And then we have on the right bottom side, we got cardiovascular disease prevention. So ginger was actually found to support reduction in blood pressure. And then we also have reduce in cholesterol accumulation in macrophage foam cells. So that's a part of that inflammatory process that I talked about earlier that is responsible for arteriosclerosis, right? The development of arteriosclerosis. Remember, it's not just cholesterol, it's also the inflammation and the overactivation and migration of those immune cells and macrophages and the formation of foam cells, right, in the arteries, which is causing that plaque to build. And on top right, we got antiviral, antifungal activity. We know that ginger also have antimicrobial activity, which is also great for if a patient has a dysbiotic gut microbiome, then ginger could be one of those supportive agents to help as in terms of the therapy. So if you want to read more about this, this was published just recently, 2023. It's called Antioxidant Activity in Extracts from the Zingiberaceae family. Good luck saying that 4 times. Cardamom, turmeric, and ginger. And this was published in journal Molecules. And I posted the citation on the right side, so you can read this. Now, we wanted to bring you to show you there's different ways to integrate this, of course, into patients' diet, right? One of the ways the easiest way, of course, is to take a supplement, right? You buy a supplement, hopefully from a professional grade company. That's something that we put a lot of emphasis in our advanced functional medicine program. We even have a whole class on how to pick your labs and how to pick your supplements, professional grade, just to make sure that you're getting what's on the label is in the capsule, right? Or what's in the capsule is actually what's on the label. But there's also fun ways to integrate this, because some of these as spices, they can be used, for example, in different dishes. So here's a picture of a carrot ginger soup, and there's a lot of those. So if you just Google ginger soup, ginger rice soup, ginger tomato soup, ginger carrot soup, This one, it just looks like super healthy, super fun. It's got some olive oil, diced onion, garlic, 3 tablespoons of ginger that is minced or finely diced, a little bit of carrot, peeled and chopped carrot, and a little bit of vegetable broth. Pretty simple to make. It's literally just stir-fry the ingredients, and then cook for 20 to 30 minutes. Pretty straightforward. Looks delicious. And this is from Downshiftology website. And as I mentioned, there's a lot of other recipes you can find online. So one of the cool things that I always try to do when I cook it in my house is for my wife and our daughter is look for how can I integrate these ingredients into into delicious meals, right? So I like to experiment and find, and thankfully today in the tips of your fingers, you got recipes pretty much for everything, right? But it's just to give you an idea. So let's move on to the next superfood. Dr. Chill, take us into superfood number 3.
All right. The third one is or are flax seeds. So these seeds provide a blend of healthy fats. These include your monounsaturated, your polyunsaturated, and these are all essential for heart health, and then protein, and then they also provide a lot of fiber as well. And they are a plant-based protein. Because of that protein, they also support muscle repair and growth, and they're all rich in omega fatty acids. And flax seeds, these are also rich in phytoestrogen lignans and ALA, and these oils have been shown and suggested to have some anti-cancer effects. So when clinical trials were conducted on flax seeds, one of the main questions that these trials asked were if flax seeds and its lignin and oil components can effectively reduce cancer, in particular breast cancer risk and then tumor growth. And then can they interact beneficially with breast cancer drugs? So these trials showed that flaxseed at 25 grams a day with 50 milligrams of lignans at 32 days, this showed to reduce tumor growth in breast cancer patients. And then lignans at 50 milligrams a day for a year reduces the risk in premenopausal women. So some of the mechanisms that these trials were showing was that these lignans and the flax seeds decreased cell proliferation, angiogenesis, and then it increased apoptosis. And this is through the modulation of the estrogen metabolism, the estrogen receptor, and then the growth factor receptor. And these are all the signaling pathways that helped to decrease these cell proliferations. Now, what these trials also stated that more trials need to be conducted, but overall, there is evidence indicating that these components are effective at reducing the risk of and reduction and the treatment of breast cancer, and it's safe for consumption by breast cancer patients. And if you want to read more about that, this is called flaxseed and its lignin and oil components, and they can play a role in reducing the risk and improving the treatment of breast cancer. Now, let's do a deeper dive into the mechanism of flax seeds and how it can help with reducing with being anti-cancer. So let's pop up a picture here for you to take a look at. Okay, so here we could see that the polyphenolic phytochemicals, phyto just meaning plants, chemicals, so phytochemicals is plant chemicals, these are capable of interfering with cellular and molecular processors. And this is all in various stages of the carcinogens, as we can see in this image here. And if these phytochemicals, they're going to block the cancer initiation, and it's going to inhibit the pro-carcinogen activation into electrophilic species and their subsequent interaction with DNA. Also, the phytochemicals are going to stimulate the carcinogen detoxification This is shown on the top image there. And then the second image on the bottom, the phytochemicals are going to suppress cancer by interfering with cancer promotion. And this is a reversible process that involves non-genetic changes or by regulating cancer progression. And this is a complex process that involves both genetic and non-genetic changes as well as cell survival. So it's these polyphenols that we were mentioning earlier, right? This compound is gonna pop up again. And what these polyphenols can do is they block these agents, and others act as both a blocking and a suppressing agents. And then it's these suppressing agents that modulates autophagy, cell cycle, and differentiation. And this is what causes the effect, this is what causes the effect of the cancer cell proliferation, and it blocks all of that. And if you want to read a little bit more of the biochemical process of this, it's called flaxseed lignans as important dietary polyphenols for cancer prevention and treatment. And it's the chemistry, the pharmacokinetics, and molecular targets of pharmaceuticals. And this was published in 2019. And an important note with flaxseed is whole flaxseed may pass through your intestine undigested, which means you won't get all of the benefits. So it's recommended to ground over whole flaxseed because the ground form is easier to digest. Another tip with that is that if you have ground flaxseed, some of that might be oxidized. So what I typically recommend to my patients is to get the whole form, but grind it that day when you consume it. And then that decreases the oxidation levels of that ground flaxseed.
Yes, absolutely. It's so important. And we've seen, and I'm so glad that you're bringing this up and discussing the different pathways here, because there was one particular study that I've came across that showed that there's for every 3 teaspoons a day of flaxseed, there was a significant increase. It was associated with a significant reduction in the risk of breast cancer. So we know that breast cancer is very small amount. Is according to one report, only 5% of breast cancers are actually genetically induced, and it's close to 95% susceptible to environmental exposures, right? And that's exactly what we talk about when we go into the oncology sections and environmental medicine in the advanced functional medicine program for healthcare practitioners. We talk a lot about the different mechanisms and pathways in which the different endocrine disruptor chemicals upregulate certain genes that can increase the risk of cancer. So I'm glad that you mentioned this. Whole flaxseed is when you ground it, you can, like Dr. Chill mentioned, grind it fresh, eat it, get it fresh. And then another tip, if you want to grind it like a larger amount, then at least store it in the fridge, right? And some people even store it in the freezer just to make sure that it doesn't oxidize as quickly. So let's move on to superfood number 4. And this is a lot of fun because I feel like we're still learning functional medicine. We're talking about functional medicine, just now we're doing it through from the point of view of food as medicine. So it's a lot of fun, and hopefully you're enjoying this as much as we do. And so we're going to talk about the next one, which is superfood number 4, which is green tea. So green tea has dietary polyphenol, and the dietary polyphenol is called EGCG. It's a powerful antioxidant and anti-inflammatory properties that it has, and it can target multiple types of conditions. So it was found to reduce the risk of cancer, cardiovascular diseases, diabetes, and neurodegenerative diseases. And it has, in some studies, more specifically neuroprotective effects which has been reported, for example, with Alzheimer's disease and Parkinson's disease, two of the most common neurodegenerative conditions. So we're going to talk about how does it work when we drink a cup of green tea, like a real good cup of green tea, or if we take the supplement, what does it actually do? So essentially, there's multiple targets that EGCG basically activates, and a few of the mechanisms that, and if you only remember 3 or 4 mechanisms with EGCG, remembers that it prevents protein misfolding, which is one of the major contributors to the development of Alzheimer's and Parkinson's. And then we have reduction in oxidative stress, which we already talked about. As antioxidants are really important to prevent cellular damage or organ damage. It also induces apoptosis of cells that are not functioning well. And it was also found to be beneficial in reducing neuroinflammation. And so, of course, we like to use a visual because the visual is easy to see and easier to remember. So on the right side, you can see the impact of EGCG, and the full name is epigallocatechin 3 galat, and it has multiple modes of action. So in the middle, you can see a nice cup of green tea, and it modulates amyloid aggregation, which prevents protein misfolding. It also has anti-neuroinflammation, right, which prevents neuroinflammation, one of the major contributors to these conditions. And it also has an antioxidant effect that reduces the damage of free radicals, reactive oxygen species, and then anti-apoptosis, which prevents apoptosis. Now, very interestingly, because there are multiple mechanisms here, right? One of the major ones is reduction in inflammation and antioxidants. So remember, that's something that we talked about previously because it's important, because if we don't reduce the inflammation, if you see a patient with dementia, Alzheimer's, Parkinson's, MS, if we do not reduce the inflammation, the damage is ongoing, right? So that's important it's important to remember. Now, another thing that is really important to remember is that we're talking about foods that could be really, really beneficial for reducing inflammation, oxidative stress, all of that stuff. But remember that it's also important to continue to learn and dive deeper and understand what's causing those, because we don't want just to replace a herb or a nutritional strategy with, replace a drug with a herb or nutritional strategy. We want to not just provide natural solutions, or other solutions, but we also want to figure out what's causing the damage, right? That's something that's really important. So here's the picture. We're posting also you can see the study is called Green Tea Targeting Protein Misfolding in Drug Discovery in Neurodegenerative Diseases, Journal of Biomolecules. And how much green tea would you want to drink to get that benefit? So typically we're talking about between 3 to 5 cups of green tea per day. I wouldn't recommend to use the processed type that has the caffeine removed. I would recommend to use, if possible, organic. Remember that green tea and a lot of other foods are sprayed with pesticides. So if you can, it's not too expensive, and if possible, get organic green tea from a good source. You can just put a few leaves in the water. You can get it on Amazon. It's really affordable when you get it bulk. And just in our office, that's something that we have. We have a whole bag of green tea. We just put a few leaves in water. It gets really big. The water gets green, has that nice taste of green tea. If you like it sweet, then add some stevia, right? That's like a natural sweetener that does not have, it's 0 calories, does not trigger an insulin reaction, and you can use that very, very safely. Now, one thing that I did want to mention, green tea has really interesting impact. It has, on one side, it prevents apoptosis and cell death, which is great when you don't want to lose more nerves in our brain than we already have. But it also induces apoptosis in cancer cells, and there's multiple pathways. For example, it increases the expression of tumor suppressor genes like p53, and inhibits the activity of STAT3. That's an oncogene that promotes cancer cell survival. So it inhibits that activation of STAT3, which reduces cancer cell survival and proliferation. It also reduces the mitochondrial membrane potential. That was really interesting, something that I took note about in a colon cancer cells. They found that green tea actually reduces the mitochondrial membrane potential and leads to instability that could trigger apoptosis. So that was another really interesting mechanism that I want to mention. So if you remember, 3 things with green tea is: 1, prevention of neurodegenerative conditions; 2nd, anti-inflammatory; and then 3rd, it has that anti-cancer properties, right? Now, if you want to take it in capsules, I use it in capsules. It's just easier for me. I'm not always able to get 3 to 5 cups of green tea, and I like to enjoy tea if I have time to. So in between, so what I do is I take 400 milligrams of green tea extract. It's just 1 capsule a day, and it's got a little bit of caffeine, really small amount of caffeine, but it's more for that benefit of that anti-aging, neuroprotective. And we have, my grandmother passed away from the complication of Alzheimer's. It was a very rapid decline from a smart lady that spoke 5 languages, declined really fast. So for myself and my father, it's really important that we do everything we can to make sure that we stay healthy, right? So now we're heading towards one of the best superfoods, I would say, and most delicious superfoods that we have. And Dr. Chill, take us into this delicious superfood that we can all enjoy, and also have some really cool recommendations on how to enjoy this guilt-free. So take us into superfood number 5.
Yeah, so this is my favorite superfood. I think this is Dr. Cohen's favorite superfood as well. This is dark chocolate. So this comes from the cacao bean, and it's this cacao bean, or the dark chocolate that comes from it. The research is revealing that it has beneficial cardiovascular effects, and this is mainly due to the polyphenols. And again, there's that word again, that's that compound, right? It's the polyphenols that are primarily found in fruits and vegetables, also the cacao bean. And it is this beneficial effect of the polyphenols. This, with the cacao bean, can increase the bioavailability of nitric oxide. Dr. Cohen was mentioning that we would be speaking about nitric oxide earlier. This is why we're discussing the nitric oxide benefits through dark chocolate. And this is what explains the improvement in endothelial function, reduction in platelet function, and then the potential benefits of and effects on blood pressure, insulin resistance, and blood lipids. So let's take a look at how this works with this awesome, delicious superfood. So we can see here that the polyphenols in the coca bean, the mechanisms occur when the flavonoids of the coca might exert their benefits on cardiovascular health. And what it does is the nitric oxide is released from the endothelial cells, mainly in response to the shear stress elicited by the circulating blood or the receptor operated substances such as acetylcholine, bradykinin, and serotonin. This is all on the bottom image there. And then once that's released, the nitric oxide increases the levels of a molecule called intracellular cyclic guanosine monophosphate, or cyclic GMP. And this leads to relaxation of the vascular smooth muscle cells. And it's this vasodilation that also prevents the leukocyte adhesion, the migration, and then the smooth muscle cell proliferation, along with the platelet adhesion and aggregation. And it's these effects that can reduce the production of reactive antioxidant species, or the ROS, and this contributes to the endothelial function, thus improving our cardiovascular function. And we can see, as mentioned earlier, that the nitric oxide is going to have these antioxidant, anti-inflammatory, antiplatelet effects. This is all going to help with our lipid levels, our blood pressure, our insulin resistance, and eventually our clinical outcome. It's important to note that all of these studies with the coca bean and the dark chocolate, that this was significantly reduced, all of these benefits, when that dark chocolate was consumed with milk, or the coca was ingested as a milk chocolate. So when you are purchasing your dark chocolate, it should be pure dark chocolate, no milk chocolate with that. So, and Dr. Cohen is going to talk a little bit more about what chocolate you can get. And I'm actually getting really hungry now that we're talking about all these superfoods.
Yes, thank you for explaining all of that, because it's always really interesting. You don't really think about chocolate as, in the physiological benefit of it, right? And even just looking at this study with, the nitric oxide and how it, benefit cardiovascular health and healthy circulation and all of that. It's really neat. It's like, I think I'm going to enjoy chocolate tonight like a lot more than I
Right.
than I typically do. So yes, we do have a recommendation, something that works. I found something that worked really well for me, because like Dr. Chill, I really like chocolate, and my wife likes chocolate as well. And it's one of those, like, we'll open a package and there's probably not going to be anything left, right? So, but one of the things that I was always concerned about is, if any of you try to ever make chocolate by yourself, I used to cook a lot more than I unfortunately have time now with all these projects that we have here. But I tried once to make chocolate, and essentially you melt down cocoa with some fats, and so you can add some milk to it. You can buy like cocoa, like real good cocoa powder, and make it yourself. But what I found is that it was so bitter. So I added some honey, and I added some this, and then I was like, I don't want to add sugar, and I added a little bit more of this, and a little bit of agave, and a little bit of this. I was like, holy moly, this is like, I added so much sweet, and it was still bitter. So so when you look at chocolate, like that's the biggest problems with the commercially available chocolate, is that it's packed with sugar, which we know that you're going to get a lot of benefit from cocoa beyond just being delicious, but that added sugar, it just, and we talked a lot about, what different foods and nutrients are doing to your body in our programs. but sugar can inhibit the function of the immune system, which puts you prone for different diseases, right? And then we know that it's inflammatory, and it's also contributes to bacterial overgrowth in our gut. So I was thinking about something that how can myself and my wife enjoy chocolate if it's a little bit or more than a little bit, right? Without the guilt of sugar. And so I found this brand. I'm going to put a picture on. It's called Lily's Chocolate. Some of you might already know it. It's a really good brand. They got multiple flavors from like original to like highly concentrated, like 70% or 80%. There's coconut flavor. One of my favorites is they have cashew. They have cashew almond. They have cream milk. So they got some really fun flavors, and it's sugar-free. It's completely sugar-free. They use a little bit of stevia. They use kind of more of a natural sweeteners and very small amounts of them. So it's just great. It's let's say a healthier alternative and to other sugars, and they don't add a lot of different ingredients like other products that I don't like. A lot of artificial stuff. So they don't add those artificial ingredients. So if you love chocolate, check out Lily's. We're not sponsored by them, so we're not making any money by recommending to you. We recommend to you everything we recommend to you is stuff that we're using ourselves. We're recommending to patients. We got years of clinical experience, and that's why also me and Dr. Chill are so excited about talking about food as medicine, because we have recommended this stuff to patients and we have seen really great clinical outcomes. So food is medicine. That's what we love to use. And that's really beyond the functional medicine, the amazing transformation that functional medicine can offer patients by looking at the root cause, understanding the root cause, and then very specific, targeted nutritional and herbal and lifestyle medicine. So really taking the best out of functional and integrated medicine. And this is really, as we conclude, I wanted to talk about something really cool that we got coming up in October 12. We just got the date set up today. We've been working on this for quite a while in preparation. And on October 12, we have the Clinical Functional Medicine Summit, which is on the weekend. It's on a Saturday. And essentially, this summit is really where we come together for a few hours and we go over the entire clinical aspect of the functional medicine. Now, we talk about the factors, how to identify them. We talk about some of the important labs. We go over a couple of case studies on how to put this together all in place and show you how to actually use all of this in your practice. And we also give you this amazing tool that took us several years. We invested a lot of money, a lot of time, and a lot of effort in developing the clinical guide. So there's an evaluation tool that essentially we give you license to use, and you can use it with as many patients as you want. That evaluation tool is essentially patients fill it up before they come to see you, and then when you look at the results of it, within probably 2 to 3 minutes, you'll know what are the major root causes that you want to focus on. And then it comes together, in case you're asking yourself, well, what do I do with that? Like, what strategies would I use? What labs would I order? Treatment protocols? We got you covered. We have all of that in the treatment protocol clinical guide that comes with it. So, and Dr. Chill, you had some awesome experience. You've been coaching our students in the program on how to use it. So you want to share a little bit about what it looks like, what was the experience?
Absolutely. I mean, the biggest thing is that there's so many complex concepts within functional medicine. So where do you start with this? how do you prioritize everything? And then what do you do with prioritizing labs? So that functional medicine health survey can be used as a guide for practitioners on what to assess for root causes or the contributing factors. And then from there, you could figure out what are the main root causes that you want to assess and investigate for those patients. And then from there, you can use that to determine what treatment approaches you want to go into. And then practitioners can set up coaching calls with me to go through that whole process. So you could really figure out how to use the functional medicine approach and all of these complex concepts in the clinical setting. And I'll show you and guide you on the ways to do that using all of these tools. And all the practitioners are really loving that aspect of that because they get to use all of these concepts that are being taught in the advanced section and putting it into a clinical setting or a real life setting. So they start to remember all of these concepts and all of the systems and all of the functional medicine approaches because it's a real life application of it.
Yes, absolutely. So we'll show you a picture of basically what some of those, what's basically you're getting. So we're gonna have the entire root cause system. We're gonna talk about case studies, specifically how you use it. It comes with a quick start guide. So that's another bonus that gives you different tips on how to build a practice, gives you the entire list of what tools you want when you want to open up, do your own private consultations, like many of our community members that get additional income between, we got coaches, nurses, PAs, pharmacists, physicians who are now getting paid between $200 to $800 per appointment for doing functional medicine. So we're in that one-day summit. We are going to cover the root causes, case studies, and then specifically how to use the evaluation tool, how to use the clinical guide, the treatment tools, and that's all. We also give those to you with a lifetime license, so you can use it on as many patients as you want and make as much money as you want for it forever. So this is like a awesome deal that we've been putting together. And on Friday, tickets come out. So we'll keep everybody updated. So if you're interested in that, let us know, and we can get you onboarded with that summit and save you a seat. So we'll have more information, of course, coming out on Friday. And as usual, we're so excited to be here with you. And we're blessed and honored that we have the opportunity to share everything that we've learned, share some really cool studies, go deeper into how to use functional medicine, nutritional medicine, and herbal medicine to improve your patient's health, get you better results, right? It's all about helping as many people as we can, and that also builds up our clinical skills, our clinical reputation. And then, of course, if you follow what some of our community members are doing, which are increasing their income significantly just by adding those additional private consultations or building up their practices. I want to give a shout out to one of our graduates, Gina, who is now training 4 additional practitioners into her practice to take some of the load from her plate. So she's got a 3 months waiting list. Incredible. And so we're now training 4 additional practitioners in the functional and nutritional medicine approach. So she can quadruple her capacity and also have some more free time, right? So it's a blessing to be able to do that. If you want more information of any of our programs, reach out to us. If you got any questions, reach out to us. Next week, we got an exciting podcast about anxiety. And we'd love to see all of you in the clinical functional medicine summit that will give you so many of those clinical tools and strategies. It's going to be incredible. So more information will be emailed out on Friday. As usual, I want to thank Dr. Chill for putting this together for us and sharing his clinical experience. It's always great to have you, Dr. Chill. And also I also want to thank our media team and Jacob, who without them, all of this would not be possible. And I want to thank the energy of the moon, whoever what that was, for disrupting our beginning of the podcast today with all the technical issues. But we're here, and we look forward to the coming events. Also, on the 30th, we got some really cool podcasts we're doing. We're doing a specific. This is for our community of the functional medicine practitioners. It's a special class. It's called the 3 Lessons from Successful Business Owners. So Dr. Chill and I interviewed several clinic owners. Some of them have multiple locations that have been in the game for several years. And we asked them about how did they achieve their success, and how did they get patients in, and how did they fill up their schedules, and what can we learn from all of that, right? So we're gonna come together on the 30th of this month on Monday, and it's gonna be a great learning experience. So we invite all of our community members. It's gonna be in the evening of the 30th, Monday. And then the big summit, Functional Medicine Summit, is on October 12th on Saturday. So thank you for being here, and keep learning, keep growing your skills, and we'll see you next time.